My name is Chuck Pennacchio, president of One Pair of States. Most folks know who I am. One Pair of States has been around since 2009, 2010. We're an organization that is built on a theory of change, a strategy that sees the greatest opportunity of moving forward to achieving national, expanded and improved Medicare for all, likely to take place through modeling in one or more states, even regions. And so we keep our eye on the gold standard. That's our goal, right? Is to get to national, expanded and improved Medicare for all. But at the same time, we need to be looking at different pathways. And this is where Rachel Madley, our guest today, Rachel was with us several months ago. I thought we would bring the conversation to a higher level today and talk about what needs to be part of the strategy. In other words, yeah, there are a number of different pathways potentially, but what do we need to be doing? The folks in the room here, leaders of organizations, we all need to see ourselves as leaders. We have to. This has got to be an engagement process whereby everybody sees a role for themselves. You don't have to be the person speaking before the room, but you have to see yourself playing a leadership role in some piece of the process. Just to continue, One Pair of States then has been around since 2009-10. We've worked at the state level. We've engaged with about 25 states. Our goal, and this is we're working with Representative Kerry Reingans of Michigan, and Rachel is also part of that process. We have another track where we're developing a strategy of bringing together all of the healthcare justice groups. We are hoping to get that done in mid-May. That's our goal. But in 3 months from now, we want to bring everybody together. Let's unify around a theory of change. We don't have to agree on everything, but we need to communicate with one another. We need to let each other know what the other is doing so that we're not in conflict. And if we have any disagreements, keep those issues aside. Let's support each other. Let's work together. And then after we're able to get that objective accomplished of bringing all of our organizations together, we have a couple big opportunities with Netroots Nation in Philadelphia in early June. We've got 2 single payer panels that we're promoting. We want to get that information into the chat. We want to vote for those. Stefan, you're in the room, if you can drop those in the chat for people, vote for these 2 panels, one of which is a legislators panel, and the other one is an organizations panel. So we want those panels to get good exposure in Philadelphia. Netroots Nation is the largest gathering of progressives in the country. Again, that's Philadelphia, June 4th to the 6th. The next week is Labor Notes. We want to get in front of the biggest labor gathering. They meet every 2 years. This will be in Chicago. That's another great opportunity for us to get the word out. As Rachel was saying at the beginning, and she's going to reboot the conversation for us in just a minute, is that we're in a real opportunity moment right now. Having said that, we want to be looking toward the election, but not only the election. We don't want to throw all of our baskets into everything about the election because we don't frankly know if we're going to have an election. And we know that mass voter suppression is the game plan by the GOP. They're trying to get the SAVE Act passed through the Senate. And if that occurs, there's going to be massive voter suppression, especially for women who have changed their names as a result of marriage. And in addition, they've already talked openly about unleashing ICE into targeted areas and also ratcheting up requirements for voter ID. At the same time, the State Department is suppressing the access to people applying for passports. This is all happening concurrently. We've got to be aware that this is fascism coming at us, keeping eyes wide open, understanding what is happening, staying with us, understanding that strategy requires that, again, we connect to one another, communicate with one another, and I'm going to catch Rachel's thoughts on all this. So One Pair of States, additionally, I moved here almost 3 years ago to lobby on the State-Based Universal Healthcare Act, which is another pathway or a venue or opportunity to allow states to model universal healthcare systems much more robustly, being able to access the federal healthcare dollars, as well as to get the legal ERISA, the Employee Retirement Income Security Act waiver. And when we were recently in Florida, Rachel's former boss, Pramila Jayapal, came into the room and she said, work at the state level. She very emphatic said that the states are absolutely critical right now, especially to be moving forward on creating universal healthcare models. And we have a number of states, we don't need to go down the long list, but we've got a number of states that are moving forward, and we're very excited about that. So lots of crises, but also lots of opportunities. We need to see that in crisis, there's also opportunity. It's a very fluid situation. So thanks for hanging with us. One pair of states also, we appreciate resource support. So if you can contribute to the work that we're doing, that would be huge. So again, we're building strategy by bringing together all the healthcare justice groups. And then at the end of the year, in we're probably November 14th, it's the Saturday, 2 Saturdays after the election, we want to bring together as many social justice organizations as possible across the spectrum of social justice work because we're only going to win when we all win. We're only going to win when we connect all of our social justice work. So even as Rachel was citing this recent poll, the reality is that everybody needs everything. Everybody needs all of these justice goals accomplished. And we're only going to win. And I'm going to say we only won with a future tense perspective here. This is part of what strategy building is like seeing that future success and then reverse engineering it and understanding what it was that we had to do to get there. And that's what our conversation is going to be about today. Rachel, can you just introduce yourself to the group here? I think you would do a much better job than just sort of reading off your bio. Just let folks know who you are if they're not yet familiar. Thank you again, Rachel. And Mike, do you want to come in later when we get to the Q&A? And keep in
Yeah,
mind that Rachel's only going to be with us till 12:45 Eastern time. So we're going to jam through this and going to be very, very efficient. So thank you again, Rachel, for being with us.
Yeah, thank you so much, Chuck, and everyone for having me. It's great to see a lot of familiar names and faces. I am Rachel Madley. I am the executive director of the Center for Health and Democracy, which was founded by Wendell Potter, who was an insurance executive turned whistleblower who he started his work in health reform around the Affordable Care Act and has been pushing for Medicare for all and being a watchdog on big insurance ever since. And before that, I was a health policy advisor to Congresswoman Pramila Jayapal for 3 years. And I had the honor of leading her work on Medicare for all, but also leading her office through negotiations around President Biden's Build Back Better Act, which, as we all know, Medicare for All was not on the table, but I really got to put everything through the lens of how will this help us get towards Medicare for All? And I think that is really similar to what Chuck is talking about of looking backwards and seeing, the strategy that we took and the opportunity moments that we take advantage of. And before that, I worked at the FDA in their Office of Legislation. And then while I was in graduate school, I was a member of Physicians for a National Health Program, the New York Metro chapter, and Students for a National Health Program. So have been in this fight for a long time and very happy to be with all of you today.
Terrific. Thanks so much, Rachel. So what I want to do here is just start out. This is Black History Month. We just lost Jesse Jackson the other day. Just as a shout out, this is a quote from Martin Luther King, who talks about the need for visioning, right? And the key is a genuine leader is not a searcher of consensus, but a molder of consensus. So we're not, as leaders, we don't put our finger to the wind and just see where it's blowing. We need to funnel that energy, that wind, if you will, in a direction that makes sense in terms of building a strategy for victory, having already seen that future success. So King was a visionary. I have a dream meant that he saw that future. And he also talks about the moral arc of the universe, though I would add to that the moral arc of the universe needs to be pushed in the direction of justice for all. What are your thoughts in response to that, for starters, Rachel? How do you relate to or identify with King's belief that the really genuine leadership is about molding consensus?
I think it is a perfect summary for the health justice movement. And that is because of a few things that are unique about healthcare reform. I think the first is that it evokes such passion in advocates because it's such a personal experience. I'm sure I am, um, you know, speaking for myself, I had a lot of, terrible experiences as a type 1 diabetic being uninsured and underinsured when I was a teenager. And that's really what drove me into this moment. And it's such an intimate experience that many of us either have with the healthcare system and its failings or see our loved ones go through. And so it brings that passion. But with that passion, brings sometimes disagreements and sometimes very strong opinions about the right way to go about getting to the end goal of health justice. And we see this, during the 2020 presidential primary, the debates around Medicare for all versus other pathways and things like that. And I think in this moment, we really do need to mold consensus. We need to understand, and this is not talking about everyone. There are some bad actors who truly think, private insurance is the best way to go, things like that. I'm not talking about that. But with the people who understand the need for truly universal health coverage, how do we bring all of those parts of the movement together? Because we need everybody pushing under the same umbrella. It doesn't have to be the exact same policies and plans, but everyone is needed in this fight because of the strength of our opponents, which is big insurance, big hospitals, and big pharma. And so I think this quote is such a good reminder of what we all need to do. And I think what you all are trying to do and what Chuck is leading in terms of looking at strategy and how do we get to that consensus so that we can beat the very powerful special interests that we're working against.
Terrific, Rachel. Thank you so much. And folks, if you have questions, please drop them in the chat. We'll get to those questions after we get through the main program here. I'm going to pop up our working mission statement, Rachel. I hope you've had a chance to look at it, but it's straightforward. It's the idea of creating unity across all of our social justice movements. It speaks for itself. We're committed to winning a justice for all agenda, and it articulates all of the issues that need to come together. And it's about, right? It's about bridging people, politics, and policy. We have to build the relationships. We need to build a consensus on how we practice our politics and how we articulate that and implement that in the form of policy. Can you riff on that a little bit, Rachel?
Yeah, definitely. And I think that someone mentioned in the chat earlier on when we were talking about healthcare versus housing costs, and they said it's all so interconnected. And I really think that that summarizes it. Everything is so interconnected, and I think it also goes back to the larger view that there is a corporate oligarchy in this country, and a lot of what that oligarchy is doing is causing these problems in very similar ways, just in different sectors. So, in housing, in healthcare, in transportation, in environment. And so it is all so interconnected. And I think we need to get to the root of the problem and understand that it is the same thing that we're fighting for across all of these different sectors. Um, and I also think it it's so interconnected in how it impacts folks, right? Because people who are struggling with health insurance and healthcare costs are likely also struggling with the increasing price of groceries, with the wages being stagnant compared to the increasing cost of housing and things like this. And so it really is so interwoven that our mission has to be interwoven. And so even if, our reason for coming together is health justice, I don't see us getting to health justice without getting to disability justice or climate justice or racial justice, because we will have to undo a lot of the structures within the corporate oligarchy.
Terrific. Yeah. Unifying health and healthcare justice, right? Health being everything else, healthcare being the system. And if the healthcare system is wrapped around with an unhealthy society, it's unsustainable, right?
Yeah,
Yeah.
definitely.
Thanks so much. Here's a just a starting point vision, very simple, straightforward, with kind of a more of a global focus here, right? Think global, act local. Let me just throw this one up and get your response. I hope you've seen this one before. So it's the United States is a just and nurturing society, a responsible citizen among and between the nations, tribes, and peoples of the world, and also a dedicated steward of the earth. How does that resonate with you, Rachel?
I mean, I think it's an incredible vision, and I also think it's what drives most of us on this call to be doing this work. I know a vision of a country like that is what drives me to be in this work. And I think the nurturing word in the vision is really important as well because we, our country right now is very much lacking in that nurturing aspect, the our government. And you don't just see that in our health insurance and healthcare system. We're seeing it in our education system that is crumbling, and we're not providing teachers with the resources to nurture our youth. We're not providing parents with the resources to nurture their children and themselves when they become new parents. I became a new parent a few years ago and really had just a crash course in the lack of support for parents and working parents. And I am incredibly privileged in that I even had paid leave and things like that. So I think that word nurturing is one that I really want to focus on in this response because a nurturing society will also help with the health status of everyone in the country because our bodies will not constantly be in fight or flight under the stress, feeling like we are in a crisis because we don't know if we will be able to pay our rent next month, pay a surprise medical bill, even go to the doctor. And so the vision itself is amazing, but I think nurturing, I really wanted to underscore that because I think that's something that we should all be striving for.
Terrific. Yeah, thanks so much. Okay. Um, uh, Again, folks, drop any comments in the chat. What I'm doing right now, Mike and Rachel, is I'm forwarding you this Word doc. It's the Strategy Building to Win 3.0. And if you're able to share it, I'm having a technical
Oh
problem
yeah.
with my. Do you see it?
Yes, let
Okay.
me.
See if you're able to share it, or Mike.
All right, I'm gonna try and share my screen.
Thank you.
There we go.
Teamwork.
Okay, I'm just gonna make
Beautiful.
it bigger.
Yeah. Yeah. So
Okay.
some of you have seen this before, but it really bears reminder of how best or most effective way to go forward in this work. I've shared this with many of you. As a young teen, I picked up a book by Edward Bellamy called Looking Backward. And Bellamy was writing from the perspective of dystopian Boston in the late 19th century, the Gilded Age. And in society, it was a place where people simply were not taking care of each other. And the story takes the protagonist and launches this person to the future, to the year 2000. And this individual wakes up in basically an underground tomb. He'd gone to sleep for 100 plus years. He wakes up and then has a conversation with his host, the guy who now owns the house, a physician. And he looks around at the society and says, well, this is astonishing. People are taking care of each other. How did this happen? And so that's a starting point for seeing that vision, that future vision, and then unpacking it, right? Reverse engineering it. So, Rachel, I'm going to just leave you some talking points, or just let's have a conversation here about, what do you think we had to do to win? I mean, thinking from the present, but I mean, thinking from the future, looking backward, right? That's the idea here is like visioning forward, looking backward. What did we have to do to win, in your view?
Yeah, it's such a great question, and I really love this way of thinking about it. So I think the biggest thing that we had to do was weaken the health insurance companies. Um, in the healthcare space, I think there are three special interests that I mentioned before: big insurance, big hospitals, and big pharma. I believe, and Wendell and I have talked a lot about this, that big insurance is our biggest opponent. The magnitude of their revenues and profits is much larger than hospitals and big pharma combined. That is not to say that hospitals and big pharma do not need to be addressed, but we believe we need to start with the insurance companies and then move on to the other two sectors.
Mhm.
Um, One thing that we need to do is think strategically about how to weaken their influence. So, in the case of big insurance companies, they are mainly for profit now. Even the Blue Cross Blue Shield plans were purchased by Elevance, which is now a for-profit company. So, one way of how we weaken them is to stop their ability to profiteer on health insurance and federal government programs. And I want to share an example where we've seen success, and that is the Medicare Advantage program. And some of you may have heard me talk about this before, but if we look back at, 2020, there was a letter that used to go around in Congress, and it was written by AHIP, the America's Health Insurance Plans. So the industry group wrote it, and it basically said Medicare Advantage is so great, keep paying them as much as they need, et cetera, et cetera. Um, Over 400 members of Congress on the House and the Senate side would sign it and send it to the Centers for Medicare and Medicaid Services every year before CMS announced how much they were going to pay the Medicare Advantage companies. Now, at the same time, what was not getting a lot of focus was that Medicare Advantage companies, which Medicare Advantage is are private companies that run Medicare plans, different than traditional Medicare. What people were not focusing on was that Medicare Advantage companies, which are, United, Aetna, Cigna, Humana, um, they figured out how to game the system. And so they are receiving around 75 to 80 billion dollars in overpayments every year because they're cheating the system. But then you have 400 members of Congress saying, this is great, keep it going. So in 2021, there was this incredible, coalition that started to be built of healthcare groups from all spectrums of the Democratic Party and even some on the Republican side. So you had groups like Physicians for a National Health Program, National Nurses United, coming together with groups pushing for similar things like the Center for American Progress, and even folks from the Committee for a Responsible Federal Budget, which is a right-leaning organization. And everyone came together and started educating the public and members of Congress about how Medicare Advantage was gaming the system. In 2021, when I was with Congresswoman Jayapal, we started what we called the Medicare Advantage Accountability Letter. So this was a counterweight to the industry's letter, and it basically said, stop this profiteering by Medicare Advantage companies, et cetera, et cetera. It's now an annual letter. The signership has increased. But why I'm talking about this is because Medicare Advantage reform is not Medicare for all. It's much falls much very short of what we want and where we want to stop. However, in 2022, I believe it was, the Biden administration did enact reforms to Medicare Advantage to cut down on some of those overpayments. It wasn't everything that we wanted, but I truly believe that we got it because we united all of those groups around a shared goal. And at the end of 2025, United Health Group actually mentioned on their earnings call that the full implementation of those changes had been made, and they were expecting to lose $6 billion in profits that year because of those changes. And so that in and of itself is very, very important. We've been continuing to push on those reforms, and just this year, the Trump administration released their proposed payment rates, and the proposed payment rates are much lower than anyone expected. It's really cutting back on the Medicare Advantage gaming. And in the 24 hours after they released that proposal, um, United Healthcare or United Health Group lost $60 billion in valuation of their company because there were small policies in comparison to what we're fighting for that are being put on the table. And so I think one thing that we need to do to reverse engineer is to strategically weaken our opponents by doing things that will get us closer to Medicare for all. Because if we can stop that profiteering of Medicare Advantage, it will increase the sustainability of the Medicare program overall, and it will increase the amount of people who enroll in traditional Medicare, which is the public program that we're hoping to build single payer and Medicare for all off of. Um, Another thing that's related to that fight is I think we have to take a parallel strategy. And what I mean by that is while we push for single payer and we continue to educate folks about it and why it's the right answer, I think we also need to take advantage of things that are moving in health policy that will help get us closer to single payer. And so the way that the Center for Health and Democracy often works is we are continuing to push on this track towards single payer, but on this track, we're looking at things that are moving in health policy. So the Medicare Advantage fight was one example. And we, in our minds, thought, how can this help us get closer to Medicare for all? Let's push for that to happen. There's some other things I think that belong in, I'll call it lane two over here. And again, groups like Physicians for a National Health Program have been working on things like this. Deprivatizing Medicaid. So, private health insurance companies now run Medicaid programs in about, I think it's 46 states. So, United Health Group is also running what's supposed to be a very large public health program, right? There's a lot of interest right now because of the one big bad bill to deprivatize those Medicaid programs to save states money so that they can reinvest it into filling the gaps that the one big bill left. And again, it's not Medicare for all. However, it takes significant power away from the health insurance companies if we were to deprivatize Medicaid. And also, it, um, it, sorry, I saw a comment about taking the document down so folks could see me. Um, it deprivatizes Medicaid, but also it builds the public infrastructure for a public health program like single payer, right? And so that's something else that belongs in lane two. Another example that I'll talk about is Medicare expansion. And this, again, has been talked about in a lot of different ways. It's not Medicare for all, it's not single payer. However, when the Biden-Sanders Unity Task Force was formed for healthcare after the 2020 election, when Senator Sanders lost the nomination, and so Medicare for All was not on the table. Congresswoman Jayapal and Dr. Abdul El Sayed and some other single payer folks were on that task force. And when they were discussing expanding Medicare, there was a question about whether it would be through a Medicare Advantage style program, so private insurers would be administering it, or if it would be truly public. Um, there was, a lot of debate. What ended up being put out was something that was truly public and would specifically prevent Medicare Advantage from being involved in Medicare expansion that they were talking about, whether it was lowering the Medicare age, whether it was a Medicare buy-in, dental, vision, and hearing benefits, things like that. And, you know, that piece of President Biden's agenda moved forward, a little bit. It didn't make a lot of progress, but if we think about it in terms of single payer, if single payer advocates had not been there pushing for those changes, we very well could have seen an expansion of the Medicare Advantage program, which would take us backwards further away from single payer. And so I think if we look back, once we've won single payer, we will see that we took advantage of every moment to get us closer to single payer and to where we want to be, even if it was uncomfortable and even if the end goal of that moment was not going to be single payer, we took advantage of every moment to move the window of opportunity. Because if we think about, before the 2020 election, President Biden probably would not have been talking about expanding Medicare the way he did in his platform for 2020. But the window of opportunity is consistently being pushed by single payer advocates so that we can take advantage of those opportunities. And so um, I think those are two key things. I think we have to strategically weaken our opponents so that it's easier to get to a single payer system without them in it. And also keep that two track idea in mind because single payer advocates have to be at the table even for those foundational reforms that will not get us to single payer the next day, but will get us much closer or have the potential to take us backwards.
Can you address the question of campaign finance a little bit?
Yes. So campaign, and I'm trying to find the specific question. Was it just talking about the big insurance money in politics?
Yeah, I mean, really across the board. I mean,
Yeah.
this is there's an intersection, right? Of
Yeah.
the billionaire interests are in every one of these pots, right? So we need to see the intersection of healthcare justice, right, with everything. I mean, big tech is just
Exactly.
gobbling up our minds and it's filling our head with misinformation, disinformation. How do we what do folks need to do, right? We need to build a movement here, right?
Yeah.
So what does that look like? Or what did that look like? How did we
Yes.
successfully win that?
Yeah. So, and the Center for Health and Democracy is actually working on something that hopefully will help. And we will look back and see that it was really helpful in getting us here. But I think we need to spotlight the candidates and members of Congress who accept money from the folks who are keeping our healthcare prices high. So we're actually working on a website that folks will be able to log on to and see how much money candidates and members of Congress have accepted from the big insurance corporate PACs as well as the AHIP corporate PAC, and then potentially look into some more, from the executives and things like that. And I think it's really making it visible that while these elected officials are speaking in hearings and saying healthcare costs are too high, they are accepting money from the people who are keeping the healthcare costs too high. And at the end of the day, that money often comes with strings. They're not written out, but they get a lot of money. And also, the campaign financing is very confusing. And so that's what hopefully our tool will help to demystify it as well, because members of Congress have their own congressional accounts and then campaign accounts, and then they also have what's called a leadership PAC. And so a health insurance PAC, Political Action Committee, which is a corporate PAC, could donate the maximum donation to a candidate's individual campaign account and then donate the same maximum donation to the candidate's leadership PAC. And so it's very hard to find all of this information. And so what we did in the future is we demystified that for people and we put it out there so that people made sure that they knew who was going to be accountable to them as an elected official and who was going to be accountable to the big insurance corporations. And looking even further back, the Build Back Better fight, we did have a small win on drug price negotiation. Before that, there was a toxification of donations from big pharmaceutical companies to many Democrats. And so many Democrats stopped accepting big pharma money. And it was a piece of the strategy of getting us that small win. And again, it was not everything we wanted. We still have a lot of work to do there, but I think looking at the strategies that got us even a little win is something that's very illustrative of what we need to do. And so I think on campaign finance, exposing it, bringing sunlight to it, and then of course overturning things like Citizens United. But
Right.
in the current climate, we can't we can't do that right now, and that's a little outside of the scope of what CHD works on. So we're doing what we can, which is digging through those FEC and SEC reports to shine sunlight on the campaign donations from these big insurance companies.
Terrific, terrific. Yeah, and you only have about 5 more minutes, so I want to open it up to the floor. But I'm just going to sort of put this in a parking lot for a future conversation. But a lot of states, maybe one of the leading states, Montana, is really bringing down the hammer on corporate malfeasance, on corporate
Yeah.
corruption, right? 'Cause states have a lot more power than they seem to realize.
Mhm.
And additionally, I would love to see the Supreme Court expand to 15 members. I mean, because we have a generational problem here, right? So we don't have to
Yeah.
get into a lot of that, but just to sort of add on to what you're saying. So yeah, we will take hands, but people, please, no, very quick questions because we only have 5 minutes with Rachel. Please, Malia and I did see your point. I tried to copy and paste the whole document
Yep,
into
I
the
got
chat.
it. So,
And if people want to get the actual Word doc, just shoot your email into the chat. So Malia, then Barbara, then David, and just rapid
okay,
fire.
Rachel, here are the
Yeah.
5 points I took down for actionable items. One is building a coalition, which I can't agree with more. Two is deprivatizing Medicaid. Three is Medicare expansion. Four is spotlighting the health insurance going to Congress people. And way in the future, overturn Citizens United. Did I miss something?
The only thing I would mention is stopping the profiteering by Medicare Advantage insurers. And we're seeing that's very effective. United Healthcare, the insurance arm of United Health Group, actually gets 75% of its revenue from federal programs, mainly Medicare Advantage.
Wow.
So if we stop their profiteering there, that's a huge profit center for them. And not only does it decrease their profits, but health insurers used to be the Wall Street darlings, as Wendell likes to talk about. They're not anymore. And when their investors leave because they realize that the government is not just going to be an ATM for these health insurers anymore, they will lose a lot of power and a lot of influence. But those other points, yes, just Medicare Advantage is what I'd add.
Okay, thanks, Malia. Barbara, quick question.
I am just going to add, I'm going to state what I wrote in the chat, which I have been talking about for years, the importance of progressives getting out of their cubicles and crossing ethnic, class, and cultural boundaries, which they are reluctant to do from my experience. And mainly I live in Ithaca. And we need to form relationships with people in communities who are different from ourselves. And storytelling, for me, is the best way to do this. If we want to create change, we've got to bring as many people into the movement. Not everybody is coming as possible, and support them as they bring change to their own districts and as they go to their representatives.
Thank you.
Mhm.
Yeah,
I'll leave it here.
yeah,
Chuck knows.
right.
And
Thanks,
Chuck, that
Barbara.
link
We just
that
want,
you put in, it didn't go to the second one you put in. It went to a different place. But I'll let the other people go. Rachel, thank you. I heard you at the Hudson Valley.
Yes, yeah, it's good to see you
Yeah.
again.
Yes,
okay,
you too.
great. Thanks, Barbara. David, Sonneborn, unmute, David. Thanks. Can you unmute? There you
Okay,
go.
okay. So this is an, I may have to just send you something. It's a very important opportunity here in Orange County, California. Uh, Once a year, we have something called the Great American Write-In.
Mm.
And this is a great occasion. There's like 57 different tables. I have one through Los Amigos. And I'm bringing this up because I would like, so they have petitions, letters, and postcards uh, to Orange County agencies, appointed officials, elected officials, and it's a tremendous occasion that usually has several hundred people there. And so I'm asking uh, for uh, for this group to uh, get me any of those things, petitions, postcards,
Great.
or letters.
Okay.
And they're confined to Orange County agencies, elected and appointed officials.
Right.
So I hope
Thank,
that's something.
yeah, thanks, David. And we can continue that after Rachel has to cut and run. That was sort of for the larger group here. Rachel, any just closing comments? Just how you saw that future success, how we won. Any final
Yeah, I
thoughts?
think I think a big part of it was taking advantage of what I'm calling a health reform window that we're going to have in 2029. Of course, that depends on elections going the way that we had hoped, but a lot of polling and sentiment across the country, even across political parties, shows that people are so fed up with the current system. And so I believe that we're going to have a reform window for something as big as the ACA was in terms of magnitude in 2029. And I think looking back, if we're successful, we came ready for that. And again, it's that two-lane thing, right? We're continually pushing for single payer and ideally that 2029 reform window would be single payer where we would get it across the finish line. But as we saw in 2020, sometimes things happen. You have a presidential candidate who says he would veto single payer and things like that. So again, how do we continue to take advantage of that with reform window to the full extent? And if it's not single payer right in 2029, what can we do right then? Have the policy written out so that then we can put ourselves on a glide path. And I think if we succeed to getting to single payer, universal healthcare and health justice, we will take that reform window, crack it wide open, and make sure that we all come unified to the fight, even if we have different opinions on, exactly how we get there or exactly what the technicalities look like. Um, so that's what I'll leave everyone with. And also that, looking back, we are having success with Medicare Advantage with, we had a Republican member of Congress, Greg Murphy, say in a hearing to health insurance CEOs that he wanted to, quote, grind their companies into dust and start all over because he's so fed up with them. So, it's a crisis moment, but we have a lot of positive things that are happening. So with that, thank you so much. Happy to come back another time because I know I had to cut my time short, but thank you all for having me and thank you, Chuck, for all of your work.
You're awesome. All the
Thank
best
you,
to you and your family,
Rachel, so
Bye.
Rachel. Thank you
much.
so much. Yeah.
We need to get rid of Medicare Advantage completely.
Yeah,
You know that.
absolutely. I'm gonna get myself off spotlight here. David, did you want to just continue your ask of the group? And then we also want to make sure that folks are voting for the two panels that are in play for Netroots Nation. I think, Stefan, you dropped that in before, or can you do
Yes,
that
I
now?
did, but I'm going to do it again now.
Yeah, because a lot has sort of filled up the chat, so we'll just refresh that. Again, people, if you can help us with any resources, because I don't get paid for this work. I think you all know that. But the resources we need or is to, for conferences and tabling, we just need some resources to get our information out. So that's what we're asking people to support today. Um, Dave or Mike, anything else that I'm missing? And then we'll go back over to David and other people who have questions in the room. Mike, you're muted.
Yeah, no, you covered it. Yeah,
Okay.
we're all being kind with each other, and that's the main thing.
Yeah. It's integral to our strategy building, right? Is being intentional in our treating one another well, listening, and being respectful, even if we disagree on the margins. We need to make sure that we're working with one another. So thank you for that reminder, Mike. You're always good at that. David, did you want to finish any further comment about your opportunity in Orange County?
Well, I just want to emphasize this is a once-a-year thing, and uh, it is a great opportunity. So I need for the people to send me uh, uh, petition, uh,
Okay.
uh, letter, postcard,
Okay.
and we have just send me the scripts, and I will make copies.
Okay.
And so it's
Yeah.
I'm really interested in and furthering the work of this group, and it's a great opportunity.
Great. Yeah. Just make sure you put your contact info into the chat, David. And thanks for all you
Okay.
do. Appreciate you. I also just want to acknowledge a couple of our strategy building partners who are working to create the summit among healthcare justice groups, as well as the Universal collective of social justice groups. Lode Coleman, who's down in is it Henry County, Georgia, and also Patricia Chadwick, who's out in Sacramento, is part of the strategy building work. So we've got, and also Rachel's in that group. So we've got Center for Common Ground, which is a Black-led voting rights and civil rights organization, active in I think 9 states and sometimes beyond. Andrea Miller, who heads that, is senior advisor for us for One Pair States. So we're thrilled to be working with them on building strategy, and also we're working closely with Labor for Single Payer, Healthcare Now. And when the time is right, we'll reach out, of course, to PNHP, National Nurses United. Those larger organizations tend to operate in their own sort of sphere. But we're constructing the railroad track, the train, so that there's plenty of room for people to hop on once it's all built. Lydia, do you want to give a quick update on what's happening in Colorado? Because I know a lot of interest there is in Colorado. Do you want to just do a quick update for us?
Yes, thanks, Chuck. Hello, everyone. In Colorado, we recently raised $750,000 for the analysis a study with the Colorado School of Public Health. So we are really excited about that work being completed to raise the money. And the next phase is there's a collaborative that'll be meeting on Monday to advise the Colorado School of Public Health and provide information that they feel is important for the Colorado School of Public Health to look at, as well as bringing forward a model bill for that process. And we're also working to kick off our campaign to win and to pass legislation in 2027, at the same time working simultaneously toward a citizens initiative in the case that our legislature doesn't pass that 2027 bill. And that bill includes an enterprise, which would be a fee, a payment structure fee for how to pay for a single payer universal health care plan in Colorado. And we're excited about the study coming out in December of 2026.
Lydia, where does Governor Paulus stand on single payer?
He's term limited, so we're getting a new governor. And we're not sure where he stands.
He did sign the bill.
Sure. Okay.
He did sign the bill that
signed the bill
initiated.
in May. Yeah.
Okay.
Right. I know that we also have Dave Garibaldi, who's very active in Minneapolis. We had a fantastic presentation in our last Tuesday meeting. Dave, if you can give us just a thumbnail of what's going on in Minnesota. And I also, before I forget, a lot of people dropped into the chat, like how we use the term single payer, Medicare for all, and so forth. This is a friendly crowd, so single payer is sort of shorthand. Everybody understands what that means. It's true that single payer is the least effective. Medicare for all is seen as partisan democratic. Healthcare for all is much more effective. So, we are mindful when we're in front of audiences how we articulate and frame the discussion. So just to know that that's the actual case. Dave, do you want to give us a quick update and what folks can do to help you and support you in Minnesota?
Sure, Chuck. I appreciate that. What we have going right now is a legislative session that just started this week. We have been working prior to the session very hard to get our public programs, Medicaid programs for the low income, deprivatized and get the insurance companies, the MCOs, HMOs, whatever you want to call them, kicked to the curb, and have a direct pay system as we had in the 1980s. And we have made contact with a lot of legislators so far, and we're hoping to continue that effort and make sure that this is a priority for them. There's been a big stew in Minnesota coming from Washington, D.C. about all the fraud that's been going on here. And that was one of the excuses for letting unleashing ICE in this community. And it was just a horrible couple months. So that's distracted us a little bit. A lot of us are, of course, social justice oriented and working on the mutual aid and the protesting and those types of things. But long story short, we're continuing. We're picking up the work of getting this deprivatization done this year as a stepping stone for our single payer Minnesota health plan. And downside, we've got a governor race this year. Governor Walz is not running for governor again, partially due to the Trump administration pressure on him and blaming him for all the fraud that happened in our public programs, mainly in the housing sector, but also in the Feeding Our Futures, which happened during COVID.
Right.
So those things all happened, and our new governor candidate is Amy Klobuchar.
Not good.
She is being thrown out there as somebody that's going to be coordinated by our Democratic Party here in the state. And she is definitely not for single payer. So we're really sweating that.
Yeah. Thanks for that, Dave. Also, we did have Alfreda on the call, Alfreda Daniels, just a phenomenal, heroic organizer from Minneapolis, born in Liberia, survived the Liberian Civil War. We hear a lot of conflicting stories coming out of Minnesota. ICE is pulling out, they're stepping up their actions. What's the reality on the ground in terms of the Gestapo coming at you guys?
What we're seeing this week is less activity, but we're still hearing of some patchy activity. And we're really monitoring the situation day by day. And of course, the damage done to the community, and especially the immigrant population and people of color in general, is still there, and we're still doing the mutual aid type activities to keep them fed and housed. And we're trying to especially focus on the housing right now because rents are coming due, and they haven't been out to work, so a lot of them. And so those are what's going on. We're holding our breath that things will continue to de-escalate as far as ICE activity, but it's a day-to-day thing, and we're still keeping our fingers crossed.
Okay. And if folks want to help, you want to just drop a link into the chat. I dropped a couple things. So a lot of you know I'm an academic. I've spent my life studying tyranny and democracy. And we've just rebooted our anti-fascism website for those of you interested. It's fightfascism.us. And on the other side, we have a pro-democracy website, justiceforall.global, and that's where we're platforming the strategy work that we're doing with Lode and Pat and Center for Common Ground and Rachel Madley. So check out those two websites as well. And then again, please contribute as you're able to the work that we're doing at One Pair of States. Working on several tracks simultaneously, that's just what we have to do. Anybody else have anything to offer to the group? Let's see.
I was just going to say the New York Health Act, the Campaign for New York Health under Melanie Arugio, I think is her pronunciation. She's formed hubs all over the state to try to get people to come together to converse, maybe not a good word, with their state assembly people and state senators to try to get this bill to move forward.
Yeah.
The problem is we have Governor Hochul, who is not pro single payer, and Senator Hasty from the Bronx, again, who's been, no, actually he's Representative Sue, also assemblyman.
Right.
Very problematic.
Yeah.
in
Yeah.
trying to get this bill. And Dick Gottfried, who wrote the bill in 1991, he's gone, but he is very active in trying to get this bill working with the Campaign for New York Health.
Yeah, we're just going to have to force Hochul to do this. I know that she's a neoliberal. She's got tight corporate ties.
Right.
And it was a missed opportunity not to support Delgado when he
Oh,
was
I
running.
agree with you
Yeah.
100%.
Yeah.
Not only because he is pro single payer, but his policies in general. And he represented a very white area in, I think, near Utica,
Uh-huh.
upstate New York.
Right. Right.
And
So this
again,
is,
education, getting out and
yeah,
connecting with people is so critical to bring
right.
this information.
This is why, and it was really disconcerting to see AOC and Mamdani endorsing Hochul for reelection. This is the lack of strategic thinking on the part of people who are otherwise have good intentions, right?
Right,
We've
right.
got to be strategic, and that's why we do these meetings. We're at the top of the hour, but I've got two hands up, and we'll put a wrap on this real quickly here. Catherine and then Martha, quick comment, response, question?
Yeah, I just wanted to ask the people here yesterday at the Sabuca meeting, a few people we talked about maybe trying to get a consortium together of states that would be able to get something on the ballot by 2028. And I'm wondering if there's any people here that feel like their state has the potential to be able to do that, to get a ballot initiative on their state ballot by 2028. So we're going to try to maybe make a little
Yeah.
group that can work on those issues.
Yeah.
So
I
maybe
thought
you just put it in the chat if
Yeah,
you're,
please do that. Yeah, I
yeah.
thought I saw Susan in the room as well. Yeah, so we're working on yet another parallel track, which is ballot initiatives. Not every state allows citizens to put initiatives on the ballot, but those states that do, that's another track where we can fight. So, yeah, another opportunity. Martha and then Hank. Martha?
Yeah, hi everybody. Martha Livingston from New York. I've been working with PNHP and the Labor Campaign for Single Payer and others for many years. And we are focused now on the New York Health Act. And I just wanted to sort of give a little different perspective on where we are with that. The fact is that the vast majority of both houses of our state government have endorsed the New York Health Act for years. The leaders of each of those houses will not bring it to a vote because there is opposition that they know will wind up sinking the vote. So they're on our team, but they don't want to see a vote that we lose. And so that's where we are now. Our fight is not so much with Kathy Hochul, but with, frankly, among others, some of the larger public sector unions, and also the building trades unions. And so some of us have really devoted our energy to working with labor and try and break through some of that opposition, because we know we have the votes, but it's just not going to happen at this point. My 2 cents from New York. Hi.
Okay. Yeah, there's more nuances here. Yeah, we've heard Dick talk about the challenge of the municipal union. So thanks for that. Lode from Georgia is with us. Lode, unmute.
Yes, good afternoon, everyone. So I wanted to, first, you may have seen me going through my myriad of emotions here because our Senate just adjourned for the day, but one of the bills that they voted on and passed was SB 440. This bill was pretty much to clean up our Department of Public Health. Of course, there were some programs that were obsolete that were falling under the Department of Public Health. And of course, they wanted to clean this up and not, carry that load to make it more efficient and to bring it in pocket because it's been out of pocket. But I'm saying this because we were able to add an amendment to SB 41, Amendment 1, that would bring in the Department of Public Health, through the Department of Public Health, Medicaid expansion. So I'm saying this because I believe now Georgia, we may be one of those states that will be able to produce a bill in the affirmative of state-based universal health care. It's just looking more promising every day. And now, had you asked me this yesterday, I would have said, no, not Georgia. We still have a lot of work to do. But the fact that they were able to get this bill passed with this amendment says a lot. It's not a Medicaid expansion bill, but it does allow for the Department of Public Health to expand resources and funding for recipients of Medicaid, as well as cover more people that are in need of Medicaid that fall in the healthcare gap. So I was pretty excited about that. I wanted to share that because that is a big victory for Georgia at this time.
Terrific. Yeah, we need to celebrate these victories. Thank you, Lode, and thank you for your work in helping to build out the strategy. Pat, also, do you want to come up? I know that CalCare has been reintroduced. Pat Chadwick, do you want to just, and then Nancy Greep. Pat, are you available?
Yeah, sorry. Yeah, I don't really have much more information than the last time we talked, but
Okay.
I'm in Sacramento. We're just reintroduced CalCare, the California Nurses Association, and so we're starting to canvass and table at events to get some, grassroots support and get people to advocate with their representatives in the assembly.
Terrific. Yeah. And you do have a governor's race coming up as well. Do you have any single payer candidates running for governor in California?
I'm not sure how, there's kind of a large group of people. There's one guy that I'm pretty sure is single payer. He's, but he also was Jill Stein's running mate. So,
Yes.
Catherine Lewandowski put Katie Porter in the
Yeah,
chat.
Steyer also.
yeah, I saw a debate, but neither Steyer or Porter were there for some reason. There was a debate about education in California.
All right. Well, keep
hosted
an eye.
by the Observer, which is a black newspaper in Sacramento.
Right. Okay.
So I'm not sure yet, because I haven't looked into that. There was just a large group of people, and
Sure.
hard to. But
Okay.
I'll
Well,
try to figure that out.
yeah, bring us updates when they occur, Pat. And again, thank you and Lode for contributing to the strategy work.
Yeah,
Let's see,
also,
Nancy. I'm sorry. What?
I just want I am campaigning for my bank is running to replace Doris Matsui, who doesn't seem to take a stand on. I think she co-sponsored one of the Medicare for All bills, but she's when I call her about healthcare, she's just kind of doesn't take a stand on it. So, and my bank is definitely she's been a single payer supporter for quite a while.
Yeah. I mean, Capitol Hill is its own sort of mess. I've been here 2.5 years, and it's really a slog, to be clear. Let's see, Nancy, and then Lode, and then.
Hi. First of all, thank you for this program and thank you for all that you do. I couldn't hear Pat very well, so I may be repeating, but yes, California is working on single payer, and the California Nursing Association has reintroduced CalCare. And we will be having, there will be a major rally on March 20th in favor of the bill. And we're organizing to try to get people to attend the rally and use that as an opportunity for public education. Even if the bill doesn't pass, and it may not, but we find that having the bill out there is a wonderful opportunity to educate the public and also to educate our legislatures. For example, we recently just visited our assemblyman and presented him with a petition of 2,000 signatures in favor of the bill. And, their office says, yeah, it's a great idea, but, how are you going to pay for it? It's like, hello, we've been over this so many times that this bill isn't going to cost anything and it's going to save everybody money. So I don't know how many times we have to say the same message, but I guess we have to say it over and over to get the message through.
Yeah. Thank you. And thank you for your work, Nancy. Yeah, as a Californian also, I appreciate the push. Let's see, Lode, do you have something else, Lode?
Yes,
No, your hand. Oh, go ahead.
Catherine, she asked what was out of pocket. So our Department of Public Health is it's like out of compliance. So there are organizations and programs that are no longer in service, and they are directly tied to the governance of the Department of Public Health, and they're no longer, active. So this was just to clean it up, to make it more efficient. and bring us up to speed to 2026, 2027. But Dems were able to add an amendment to that while we are cleaning it up, let's go ahead and add that our Department of Public Health will address the need for a Medicaid expansion. And you saw a lot of my facial expressions because some of the opposing statements were just asinine, to say the least, but it still passed. So thank heavens.
Thanks for that. And I'll just a shout out for the work that Lode and others are doing in Center for Common Ground. I mean, there's a huge swath, there's a huge Black population in the rural South that is largely neglected. And these democracy centers are a real important innovation, which is to create a place where people can gather, organize, and not only win elections, but win the issues, right? Identify the pain points where people have needs, critical needs in their lives, education, housing, food, healthcare, all these issues. It's really a critical step in building an actual democracy. For those of us who think that elections are the beginning and the end of democracy, we're really not thinking clearly. So that's why, we work on several tracks simultaneously, because democracy is a way of life or it's not a democracy. It's either woven into our culture and it's a part of who we are in the fabric that we build together, bottom up, participatory. So I know that sounds preachy, but it's real. So thanks so much, Lode, for all you do. Anybody else before we wrap up? Mike, do you have any closing?
Chuck, I just want to add that the Democrats, the old school Democrats, have become so corporatized.
Oh, yeah.
We got to push them out. I mean, we've got
Yeah.
Schumer up here in New York.
Yeah,
It is
yeah.
time for him to go.
Yeah.
So this is the other problem. And they, of course, have neglected the rural communities,
Absolutely.
Black and white and whomever else lives there. We've got to find a different way. And of course, this will never happen in my lifetime. We need to have 6-week elections and push the corporate money out so
Yep,
that
yeah.
we stay the constituency after they are elected.
Yep, absolutely, Barbara. Yeah, thanks for that. Thanks for the reminders and the reinforcement. Everybody, great group, really thoughtful. Again, if you dropped your email in the chat, I will harvest it. If you haven't done so, go ahead and do so. I'll be sure to send out that Word document that's, where it's all in one page. The strategy building document. And also please go to the Fight Fascism site to get some really grounding information as to what it is that we're dealing with, because I think most of us, unfortunately, are sort of living in a world of wishful thinking that somehow the election is going to solve all of our problems, and that we're actually going to have an election, and that if we do have an election, it's going to be free and fair. So we need to understand, I think, that it's going to take a lot of work to pull ourselves out of this mess right now, but we can do it. We've done it before, and we're going to do it again, because we see that future vision where we have that success, and we understand that it's all about these strategy building steps, and you all are in the fight. So thank you so much. Love to you, your families. Keep fighting. Yeah, drop your email in the chat. I'll do the same, and keep going. Mike, do we have any future announcements to make?
Not yet. We'll have speakers in March. We still lining them up. So it'll be the second Tuesday, 5 p.m., third Friday, 9 a.m. Pacific.
Yeah. Do we have a policy meeting next Friday, the 27th, you know?
Probably. Steve Campbell has not sent out the announcement yet, but for anybody that likes to attend that, I'll send that in the follow-up of this meeting.
Because another piece that we're working on with Edwin Whitehead, also at Center for Common Ground, is he's putting together a template, a concept bill that we can share around the country. One of the goals of Representative Ryan Gantz of Michigan is to get a single-payer Medicare for all, healthcare for all, guaranteed universal healthcare bill into every single state house, all 50 state houses next year. In 27. That's one of our big goals here. So just know that we're pushing every which way possible to enlighten, to educate, to motivate, to excite, to incentivize, people to move in the right direction, and the time is at hand. So, Mike, yeah, thanks for that. Potentially, we're going to have a policy meeting at 12 noon Eastern time on Friday the 27th, and Edwan will come in and do a presentation on this template bill that people can take a look at to import into your own state if you don't already have a bill, or if you have a bill that needs to be improved upon. Okay, I'll save the chat and I'll hang around for folks if you have any closing comments, but otherwise, have a wonderful weekend. Hold your family and friends tight, and we're going to get through this together. Love to everyone.
Chuck,
Thanks, Chuck.
Yes,
are
yes.
there any jobs, anything for
Paying
me?
jobs. Yeah, if I see something, I know I've got you in mind, Barbara.
Please.
Yeah. Let's talk offline. Let's talk offline.
Do you want me to call you or email is good? Or you
Yeah,
want to call
why
me?
don't you email me? That way I can sort of think about it a little
Is your
bit.
email the same as it's been?
Yeah, it's cpennacchio@gmail.com.
Okay, so it's the same old email. Chuck, thank you for this program.
Oh,
It's
sure.
always good.
Thank you.
Okay, keep warm and don't slip. That's the quote of the day they never print.
Yeah, right. Ice
Oh,
out. No ice.
in more ways than one. Yes.
Right.
Yes. All right. Bye for
Okay.
now.
All right.
Very cold here.
Where you are, it's not supposed to be cold.
I saw
It's cold here.
Zach, I saw you came in toward the end here. How are you doing, Zach?
I am doing okay, keeping busy with the jobs for all work, of course.
Yeah. Been a while.
Yes, and yeah, it's we've got a lot of positive developments there. I mean, it's of course tough going in this environment, right? But we're trying to do state level stuff. I think consistent with what some folks in the single payer space have done as well.
Yeah,
I,
yeah.
for some reason, thought this thing was started at 1, which was 5 o'clock dawn.
Okay.
When I did.
Yeah,
Anyway.
third Friday at 12 noon. I saw Jesse's 45-minute speech before the 1988 convention last night on YouTube, and he gave a shout out to for Jobs for All. The bill that was carried for many years, I guess, by Kanye.
Oh yeah. The Humphrey Hawkins bill, I'm sure is what he was talking about back then. Yeah.
Right. Yeah.
But yeah, it's we're plugging away. We have a base now at the New School for Social Research. We have an executive director who's running the effort for us now, and so we'll see where it goes, right?
Yeah. Joining arms, joining legs, everything. Yeah. So circle November 14th. It's more solid conversation. It'll probably be an in-person and a hybrid event, bringing together all of our social justice groups for purposes of winning everywhere, right? We win when we all win. That's the only way we're going to win. We all have to be together. So that's our theory of change. As you know, we've been talking about this for some time. So thanks. Zach is in Connecticut, by the way, for those of you who have New England roots. He's at what's your school again?
Southern Connecticut State University.
Nice.
I always tell people we're the other university in New Haven.
Yeah. You're the public university.
That's right. We're the public university serving working class kids and now more persons of color and so forth. So
yeah. Well, I think you're the 3 Yale refugees who moved up to University of Toronto, right? Are happier at a public university. They certainly seem to be saying so.
Toronto, they have healthcare up there, and
They sure
Toronto
do.
is a lovely city.
Yeah.
Lovely.
That's Timothy Snyder and Jason Stanley and Marcy. Forget Marcy's Snyder's wife, forgetting her last name. Anyway, any other comments, questions, issues, folks? Okay. Mike, you good?
Plenty of issues.
Oh, well, yeah.
You know that.
Have you got a couple hours? Okay.
Right,
Okay.
right.
Saving the chat.
Come for lunch, Chuck.
Okay. All right. Take care. I'm going to cut and run if there's nothing.
Yeah, and I'll send you an email. Thanks again for everything. And Mike, you're looking good. Looks like you're healing well.
Yeah,
But
Thanks.
he got
Thanks.
some
Thanks,
more
Barbara.
sun rays in Southern California, right, Mike?
Yep. Yeah. It looks like Nancy Greep was recovering from something like I was down in Santa Barbara.
Looks like it. Mhm.
yeah.
Okay.
All right.
Okay.
Take care.
Hi,
Take care,
Take
folks.
hi,
care.
Kay.
Bye for
Nice-
now. Bye.
Good
Hey,
seeing you again,
Kayla.
Chuck.
Hi, Kay. Okay.